Hi, I'm Paul Radkowski, founder of Inward Strong, a self-guided online mental health system that was originally designed to provide 24/7 mental health support to those in remote areas. COVID has put gas in the fire for mental health issues and is considered the next epidemic unfortunately, for the number of next years to come. 24/7 issues require 24/7 supports. So there are viable options, and this brief presentation will provide some of the evidence and best practices for self-directed and self-guided mental health programs. So a little bit about me. I've been working as a clinician for a couple of decades and have had the opportunity of working in the north, in northern Alberta, later on in the Northwest Territories, and as to say, I saw a lot. And having moved back to Southern Ontario, seeing the same theme, a demand for services over here, supply down here. We got tired of seeing people bleed and die in the gaps here. So we took what worked online and put it to, frontline and put it online with Inward Strong program, which is an awarded, anonymous, self-guided wellness system for individuals, families, and organizations struggling with mental health, addiction, and other stress-related issues, as well as providing resilience and psychological capital and support. It's kind of like having your own personal portable wellness coach 24/7. We've been doing this for a number of years, and over the years, received a number of awards and included a number of publications, including in KMH's textbook. In fact, we are the example of an effective self-directed program. And the awards are really for several reasons. One, how innovative the wellness system is. Two, how comprehensive it is, and three, most importantly, the fact that it is how effective it is, and that it is saving jobs, families, and lives 24/7. And we do appreciate the federal and Ontario government in terms of just being able to provide us with some funding over the years as well. So to put these issues in focus, I'm just going to invite you just to do a bit of a quiz with me. So you ready? Put your quiz hat on, if you will. Can you guess how long it takes the average person with a mental health or addiction issue before they get help? If they get help at all, can you guess how long it takes the average person? Is it A, B, C, or D? If you said the answer is D, 11 years, you are correct. And this is what's called the delay to treatment onset. And this is as recent as 2020, as cited by the National Alliance on Mental Illness, NAMI, who are in fact actually one of our US partners. What are the greatest barriers to accessing treatment for mental health? Would you say it's A, B, C, or D? If you said A and B, you are correct. Access and stigma are still a big issue. Unfortunately, again, these issues, demand and supply gap, are getting bigger, especially in remote regions. How effective do you think self-directed online solutions are in treating mild to moderate mental health concerns? Would you say it's A, B, C, or D? If you said D, equal or comparable to therapist-led support, you are correct. For mild to moderate symptomology, and we'll unpack the data in just a moment, you can guess which is far more cost-effective and scalable. So really, this is what we're talking about here. Mental health is brain health. And here's some of the latest in neuroimaging. These are called SPECT scans. And what you're seeing is a healthy brain in terms of regional cerebral blood flow, metabolically healthy brain. Notice the smooth surface means a good amount of connectivity. The light yellowish hue means a good amount of activity. That's our reference point. Next image, not looking so good. Here's a 38-year-old, 17 years, heavy weekend drinking. All substances are neurotoxic, and they will beat up the brain pretty bad. Next image, we see somebody who's majorly stressed out with a major depression of 2 or more years. In typical anxiety and depression, there's the elevated level of the stress hormone cortisol. Cortisol is also neurotoxic and will also beat up the brain pretty bad. And you can probably guess how all these people are handling stress, making decisions, trying to remember things. You better believe these issues are going to impact psychological performance. And as we know, the mind-body, it's connected. Mental health concerns will have to become medical concerns, activating the hypothalamic, pituitary, adrenal axis. And how long can you run a car at 10,000 RPM before things start breaking down? The mind can produce more stress than the body can handle, affecting not only just the brain, but other health systems as well, becoming medical concerns. So these are unprecedented times, unprecedented concerns, huge gaps in the mental health system. And clinicians like myself, we are burning out in terms of the quantity and quality of clinician that's available is becoming less and less as the demand keeps growing. So what can we do about this? Well, self-directed online mental health and mental wellness program are showing to be quite effective. And here's some of the meta-analysis that's done and summarized, and I included the links below. You could find in the databases of PubMed and Cochrane. In general, computerized or internet-based interventions for some of the common colds and other concerns are yielding effect sizes that are comparable to traditional treatment. Overall, web-based interventions are considered to be acceptable and user satisfaction is high. And essentially, we're talking about convenience. These days, if it ain't convenient, it's not going to happen. Both therapist-led as well as self-guided online therapies indicate significant alleviation of symptoms even beyond 12 months. And there have been a great deal of work on web-based interventions for mental health, interventions to be shown to be acceptable, effective, and cost-effective across a variety of issues. I'll say again, I'll ask again, which is more scalable? Therapist-led, self-directed, which is more cost-effective? I think you can probably guess. So online self-guided options like in digital mental wellness, programs like Inward Strong can and do deliver immediate access to algorithmically curated content, therapies, tools, assessments, etc., to address the specific condition of the user. Since there's no therapist involved, basically it transcends various barriers, geographic barriers, and the limited supply of clinicians. It provides ongoing, immediate, and honest support, which can help those who are on waitlist. And as you can imagine, a self-contained digital program eliminates the physical, human, communication, and capacity challenges as found in remote areas or in space. Here is some of our success to date. As mentioned, CAMH included us in their textbook as the example of an effective program, and participants in the program showed a substantial reduction in symptoms and a significant improvement in coping. And mental health is certainly at a crisis. This is a global issue, 24/7 issue, needing 24/7 support. From mild to moderate mental health issues, as well as a preventative resource, self-directed online options are an effective, viable option. Here at Inward Strong, we're out to make mental health a right and not a privilege. Thank you for your time, and please feel free to connect with us.